We are partnered today with the Junior League of Birmingham, another organization that I had the privilege of serving as president back in 2016. An amazing organization of almost 2,000 women who are committed to promoting volunteerism, developing the potential of women, and improving the community through the effective action of leadership of trained volunteers. Their vision is building a better Birmingham, especially for women and children. So it really makes perfect sense that Forge and the Junior League of Birmingham would partner together, especially for events like this. For if you don't know, 1 in 8 women in Alabama will be diagnosed with breast cancer. So it is by far the most prevalent cancer for women in Alabama and 3 times more prevalent than the next cancer. So it's a big issue for women in our community. But today, our community roundtables, our candid cancer conversations are not just about breast cancer, they're about all cancers. So regardless of what cancer you are facing, dealing with, or have a connection to, these cancer conversations are for everyone. So I want to make sure that you know that. Today, we have a fantastic panel to talk about genetics and cancer. Their bios, did you put, Elena, are they online or we emailed them out? We emailed them out. So hopefully if you are online, you have received them already. I am not going to read the whole thing, but I'm going to just hit a few highlights. And I've already asked them and they said they're fine with it. Because these are hard conversations, we want everyone to feel comfortable being able to ask questions and be in a safe environment. So we're going to go by first names today. We're not going to go by titles. They have lots of titles, but we're just going to go by first names and be in a comfortable conversation. So first we have Aundriano Capers. She is a high-risk counselor at Ascension St. Vincent's Hospital. I got that wrong in your bio. Her role at Ascension St. Vincent's is counseling patients on family history, genetics, and genetic testing. Next, we have Jennifer Kramer, who is what we call at Forge a previver. After watching many friends and family fight cancer and other illnesses, she began to get curious about genetics. And through the help of her caring and supporting gynecologists, her journey as a previver began, and we will talk about what that means. Julie Watley is a family nurse practitioner who manages the high-risk breast prevention clinic for women's cancers at UAB. She is very passionate about empowering patients to be champions of their own health care. And finally, we have Ruby Fenton, who holds her master's in business administration and serves as social impact specialist at Wells Fargo Bank. In 2008, right, I remember that from our lunch, she learned that she was BRCA positive and made the decision to undergo a prophylactic double mastectomy and hysterectomy. So she is what we call at Forge a previver as well. Thank you all for being here. We really appreciate it. I'm going to launch in. Aundriano, can you tell us the connection between genetics and cancer and why it's so important to know your family history?
Hello, everyone. Thanks so much for having me.
Is it not on? Let's see. Look, I'm too blind to see the button. I'm getting old. Okay, how did you do that? Look, there it is. Okay.
Can y'all hear me? Is that better? Perfect. Well, with genetics, within our bodies, we have genes that are tumor suppressors. And so with tumor suppressors, if there is a change or what we call a mutation within that gene, then that gene is no longer functioning properly. And so if that gene is no longer functioning properly, then it can, cause an individual to have a higher risk or even an elevated risk of certain cancers over the general population. So our gene that we love to always use as an example is the BRCA gene. And so whenever we hear about BRCA, we always think only about breast cancer, but BRCA has a link to more than just breast cancer. It has a link to not only breast cancer, but ovarian cancer, pancreatic cancers, even with BRCA2, melanoma of the skin and the eye. So men are not exempt either. If they have a BRCA mutation, then they also have a risk for male breast cancer that's elevated over the general population, and also prostate cancers. And so why it's so important to know your family history, that will help your practitioner to know exactly what type of test to order for the patient. So if you know that you have a family history, say of polyps of the colon or colorectal cancers, then we'll look at a different type of panel to order for that patient. But if you come in and say, okay, there's a lot of breast cancer, ovarian cancer, then that will lead your practitioner to think more along the lines of HBLC, which is hereditary breast and ovarian cancers. So that's why it's so important to know as much as you can about your family history, which a lot of times is not discussed. But even those things that you heard, just in hearsay or at dinner conversations during Thanksgiving or Christmas, keep those things in mind because they do help. And that's why we need to know that information.
That's great. Thank you. Julie, we're going to skip, I think, to you. What are the factors that you look at in evaluating somebody's potential genetic risks, and how do they end up in a high-risk cancer clinic like yours?
So first of all, genetics are not the only reason why people get breast cancer. In fact, only about 7 to 10% of breast cancers are from a genetic cause. The remainder of breast cancers are from things outside of genetics. So familial things can be, or just family history. It takes, as Aundriano said, it takes it into account, but a lot of times we don't have a genetic cause for breast cancers in the family. So the majority of the people I see get referred because they have a family history of breast cancer, and paternal family history matters just as much as maternal family history. And I'm surprised all the time when I still get people that think that it doesn't matter if the breast cancer was on their father's side, but it does. So I get people, most of the time my referrals are from patients that have family history of breast cancer, but there are other things that might increase somebody's risk for breast cancer. If they've had radiation to the chest for another type of cancer treatment, especially as a child or young adult, when their breasts were forming, that might increase their risk for breast cancer. There are certain biopsies. Some people have no family history of breast cancer whatsoever, but they have had a biopsy that makes them high risk for breast cancer. So we follow those people closely. And there's other genetic conditions, and you might not have a family history of breast cancer, but you might have a genetic risk for breast cancer without a family history. So we follow those people as well. So,
yeah. And I know I'm a patient of hers, so I know that like you asked like a variety of questions of like things that you would have no idea would be important to come up with sort of what is your risk
yes,
percentage.
And I'm a provider too. I probably should put that in my bio too, but I also have a family history. So this is something I'm very passionate about, and I try to practice what I preach. So, a lot of lifestyle factors go into cancer risk, hormone factors go into risk, being a female goes into risk, ethnicity plays into your risk. Alcohol is a big risk factor for breast cancer. Obesity is a big risk factor for breast cancer. So like Lauren mentioned, it's multifaceted. So it's not just a one and done. You have to ongoing risk assessment every time because things change throughout your lifetime. And the more screening that we do, sometimes that leads you to having to have a biopsy, and that biopsy might affect your risk in some way. And so it's something that we're constantly going over every time. So you don't just go for one risk assessment. Hopefully that we can see you, we can follow you. We have the opportunity to make recommendations for you to be followed through the rest of your life. So it's a privilege to be able to do that.
Jennifer, I'll ask you one next. So what was it that prompted you to decide to go get genetic testing, and what was that experience like from your perspective?
Well, I have an amazing GYN, and who sits down with me every time I see her, and just what's going on, and on their paperwork, and most people have this, it'll ask if you have a family member who has cancer. And it was like every year I went in, there was somebody else in my family that had cancer. And my mom got it the second time, and she just looked at me and said, it's time. It's time for you to get genetic testing. And I held onto that card for a while, because there's just so much that comes with that. There's so many decisions to make, even if you don't have cancer. I was telling some women earlier that my dad passed away at 66 with frontal temporal dementia with Parkinson's. And I remember sitting in the neurologist's office, and he said, "Would you like to get genetic testing?" And I'm like, y'all don't know what to do with him now,
Mhm.
I don't know that I want to know if I have a history of frontal temporal dementia. How is that going to change my life? How is that going to change the way I live? So, I mean, these are just big decisions to make. So I held onto that card and I finally went and I had the testing. Well, I came back with a breast cancer gene that's not BRCA1 or BRCA2. I had never heard of it. It's PAL-B2, which is the protector and localizer of BRCA2. So, you know, just I am a huge believer, and I think we all are here in this room, that knowledge is power, and that I like to know things. I like to ask questions. I met with you, Julie. You may not remember. I met with a geneticist. I got all the information. But one thing I have learned throughout this is it's also powerful to know yourself. And that's one of the most important things, because everybody has an opinion. There's so much information out there, you know, and it comes at you so fast and all these decisions, but it's so important to slow down and take a minute and truly listen to yourself and figure out your own path. So I can, you know, I've talked to people who've also been through this, and my cousin who is in her 30s, she also has the gene. She did not have children. She chose a different path. Hers doesn't look like mine. So I'm just so thankful that we have these opportunities to talk about it. And
That's great. Thank you. Ruby, you had a similar sort of a story. What was the process you went through? What led you to decide to be tested, and what was your experience with that?
So for me, it was a little different. My brother had died in 2008. He was 42 years old, and my parents had both passed away, not, you know, very close to that. And my dad had died from lung cancer, lung and throat cancer. And I knew my family history. I knew that my grandmother died, my maternal grandmother died from ovarian cancer. I knew that a lot of her sisters had died from ovarian and breast cancer. So I knew my family history. So when I went for my annual, right after that, I told my OGBYN, I was like, Dr. Miller, I said, you know, my brother just died. You know, we've always discussed my family history. What can I do to get ahead of this? And she said, Ruby, you'll be a perfect candidate for the BRCA2. And so she sent me, I went, and the way the program worked, and at that time I lived in Memphis, so I went with Baptist Memorial Hospital. And the way their program works, you have to go through counseling first, because their biggest thing is, can you handle it? You know, they want to make sure you're not a person who's going to suffer from depression or want to kill yourself or whatever the situation may be. So you have several required cases of counseling that you do with the counselors there at the hospital. And then after that, we did do some actual additional tests, mammograms and different things like that. And we found some spots, but nothing to be concerned of at that time, just normal things that women have. So after several years of going through that, MRIs and all that, you know, my doctor was like, Ruby, you know, insurance is changing. They're not going to allow you to continue to have like your 2 MRIs once a year. And I was like, let's do it. So we went and proactively met with my breast doctor, plastic surgeon, had it done. And then she was like, well, you know, you have to have, you know, a total hysterectomy with this. And so she was like, do you want to do it all at one time? And I was like, no, doc, we got to slow all this down. So we waited a couple years, went back to the oncologist, did the total hysterectomy. I don't regret any of it. No, I never had kids or anything of that nature. And I was in my very early 30s at the time, but I look at it like this. I'd rather be living here to talk about it than not be here just to say I had children and I left them alone, because both of my parents were deceased by the time I was 25 years old. And I come from a very long history of my aunts and uncles dying at a very young age. And so I did not want to have, if I had children, to experience that personally. So I was like, let me do what I can to last longer and be here, you know, to love on my family. So it's just my brother and I, but I still wanted to be there, you know, he and I to be here together. So I have no regrets, and, you know, thankful I did it.
That's great.
Mm-hmm.
And goes back to what she was saying about know yourself, know how you feel about these issues. I think that's great. Aundriano, I'm going to go back to you. If someone wanted to go through genetic testing, what would they need to do, and what does that entail? How would they go about starting this process?
Well, the first thing you would definitely want to do is speak with your healthcare provider. Let them know your concerns and the issues that you have as far as within your family history, if there is a family history that's there, or if you've been speaking with friends that has, discussed about genetic testing. Once you speak with them about that, then ask for a referral. Your healthcare provider can refer you to a high-risk counselor, genetic counselor, someone who will be able to help you, and the genetic counselor will call you in. You'll have pre-op counseling to make sure that you are meeting the criteria. We'll also ask questions if anyone in your family has had genetic testing. If so, then you can also look at having targeted testing or single site testing done to just test for that one single gene. Also to discuss with you how it's passed along. If you are positive, then there's a 50% chance of passing that same genetic mutation on to your children, and also for your siblings to also have that same genetic mutation. So that would be pretty much in a nutshell the process. You would have the actual sample drawn, and then you will receive your results and then do post counseling afterwards.
And it's a blood draw.
It is a blood draw. We can do saliva draws. We did that during the good old time of COVID because we couldn't have the interaction. But within the office, we do a blood draw, but a saliva draw is available. So don't let the blood draw keep you from coming in.
And then you get called back and you have a consultation of this is what we found.
Absolutely. We do post counseling as well to go over what those genetic test results mean. Sometimes patients may have a VUS, which means a variant of uncertain significance. So it's not just positive or negative. We sometimes have a VUS, which is the one that I call the little stinker that gets on your nerves because it just hangs out. There's not enough research at this time to let the patient know. It's just kind of right there. It doesn't have any significance to put a patient at higher risk or benign, but we do keep that information. And when we're notified, we notify the patient if that variant is actually either upgraded to pathogenic or if it's downgraded to benign. So we keep up with that information lifetime.
I didn't prepare you for this question, but I'm going to ask it.
Yes.
Insurance. Does insurance pay for this? Is it part of this process, or does it depend on your policy? I guess it depends on your policy. But
well, once you meet criteria, this entire process is included with us here at Ascension St. Vincent. So your pre-test counseling, that's part of it. Also the post-counseling, because you must have the post-counseling so that the patient can understand that result. So all of that is inclusive. Then afterwards, as Ruby was speaking of, we'll look at breast care prevention if the patient is over 20% threshold from the general population of having annual MRIs and mammograms every year to change those medical management guidelines.
okay.
Yes, ma'am.
So Julie, let's say hypothetically they find out that they're positive of something. What are what does that lead to? What's the next step in that? We call it at Forge that choose your own adventure book. Remember those when you were kids where like, if you decide you want to do this, go to page 34 and you have to go through that book really fast. It seems like when and so what are all the various decisions you would likely have to make if you found out you were positive?
So like Jennifer said, one of my favorite sayings is knowledge is power. So when you find that information, we help you decide, what do you want to do with that? Some people never want to find out that genetic information. That's too scary for them, or it takes them several years to come to the decision that they want to know that information. And once they find out that information, what do you want to do with it? Your choices are screening, surveillance, or surgery. For some people, there's medications that you can take to decrease risk. So everybody's path is individualized. So you have lots of choices, and we just help inform you with the knowledge so that you can make an informed decision about what you want to do. And what you decide today may not may not be what you would want to do a year or 5 years from now, because it has to do with more what life stage you're in. So a 20-year-old who has not really started dating or thought about, whether or not they want to have kids or breastfeeding might make a different decision than somebody who's, 50 and a grandmother and doesn't have to worry about, little children going to school or pulling on their drains, or how's my body going to look when I'm dating, and those kind of things. So we just try to help them make decisions that are right for them at that time. And then we change that. So mammograms, MRIs are an option for people as far as surveillance. If you can't do an MRI, sometimes we offer more advanced kind of mammogram called a contrast enhanced mammogram, or an ultrasound, a screening, and you do these things based on the ages that you are. There's medications that you can use to decrease breast cancer risk, and of course surgery. But we want people to know that once you do surgery, it's not 100% guarantee that you never have to think about cancer again, because sometimes after surgery, you can still get breast cancer after that. Or there are other types of surveillance, depending on what kind of reconstruction that you do, that you might still need to do surveillance. So if the anxiety of coming every 6 months for a mammogram or MRI is leading you to the reason why you might want to do surgery, we say, okay, that's a good reason, but you may still need some imaging. And then some people, it stresses them more to think, oh my goodness, I'm not going to be coming every 6 months to get imaging, even though I know that my surgery decreases my risk. So we have to kind of talk through those things. So it's a different decision for a different person on a different day. And it could be, you can change your mind multiple times, but usually it's, surveillance, surgery, medications.
Okay.
Are your options.
Jennifer, if you feel comfortable, would you share with us what decisions you had to make and what you decided was right for you?
I'm just listening to y'all, and I think it's wonderful what you have with your counseling. I know for me, when I went to genetic counseling, that was not set up. So when I found out that I had the gene, I was sitting in the car on the way to my son's baseball practice, and the physician called me to tell me. And I just remember it just like, what? Wait a minute, what are you talking about? So I had some friends who had undergone genetic testing and went through reconstruction. So I just began to just search. And that's how I landed in Julie's office, which they were amazing. And that's where I met with a genetic counselor. And for me, insurance, I thought this was interesting. So when I saw my physician to get the genetic counseling, my particular plan, there's a formula. There was an actual formula that, your history, that it was based on history. And so if I met this particular formula, then insurance paid it. So, and it is another thing that is amazing and wonderful, and I'm probably going to say it wrong, but it's like the Women's Act that covers this procedure. So my insurance, I did have a prophylactic mastectomy and reconstruction, and my insurance paid for it. I have also had another surgery. I can't remember what. No, I didn't. I had to have a reconstruction, another surgery, which I may be having another one. So with all that being said, there's a lot to consider, because once you have surgery, you may have to have multiple. It's not one and done. No. So my doctor calls me with the information, and then I just went and talked to everybody I knew who had undergone this, who, I met with a geneticist, I met with a counselor, and then it just made sense to me. If I can do something about this, if I know I have this gene, I know I have a propensity towards breast cancer. My mother's had it twice. My cousin who was 30 had it. My dad's mother had it, just all that history. I mean, I like to take care of a problem. So I found out about it and I said, okay, I'm doing this. And so you think it's one and done, and that feels good to check that box, but it's not. Along with the genes, even the PALB2 that I have a higher risk for pancreatic cancer, for ovarian cancer. So yes, I no longer have the breast tissue, but I do go get an MRI. My doctor wants me to get an MRI every year. I'm supposed to get an ultrasound and blood test for my ovaries. I may or may not do that every year. I haven't gone to get my pancreas checked because it just seems like a lot. And I just take it as it comes. So I'm still going through that journey, even though I feel so fortunate to not have had breast cancer. I know people, we all know people, friends, family that are undergoing it right now. And just every time I'm hear about someone or see someone going through it, I'm thinking, okay, I did the right thing for me. I did the right thing for me. Even though I'm still going through it, just watching what they are going through to fight it is incredible and brave.
Ruby, you want to answer that same question? So you got your information. What did you decide to do with it, and how has that process been for you?
Yeah, so like I said, mine has been several years ago, but they called me back in after they got the test back, and my counselor sat down with me and the doctor at that time. They both came in, they went over the results, explained exactly what the results meant to me and what my next stages would be. And my next stages were, we went right into needle biopsies, we did MRIs, we did all of that. And we continued that process, like I said, for several years, because we were just wanting to be more proactive for the first couple of years instead of going straight into doing the surgery. And my OBGYN, Dr. Miller, she was great. She agreed that would be the great, best process. But like I said, about 2-3 years later, we went in and she had spoke and she said, hey, Ruby, with insurance changing, we're not going to be able to go, through the same process, the same path. So what do you want to do? And I said, well, let's just go ahead and do the double mastectomy. And we scheduled it, and I met with a separate breast doctor, Dr. Berry, wonderful gentleman. He's still practicing now. And like I said, then I met with my plastic surgeon, and we sit down and he went through an in-depth conversation of what that looks like, what's the time frame. He was very honest. Like they said, it's not a one and done surgery, and I had the process where we did the double mastectomy with the tissue expanders behind it. So you have to go through that reconstruction process, and it's 2-3 month process. And like I was telling the young lady I was having lunch with,
He said, turn it upside down. It might. Okay.
yeah, no, she's fine. That's okay. We needed to dance.
That was interesting. I know, maybe that was like a sign from above that we need a little lightness in here. I don't know. It's a heavy conversation.
But no, that's fine. But and then we went through that process and everything, and he went over everything explicitly. Like I was telling her, hindsight 2020, I might have not done the reconstruction, only because for me personally, I can't take pain medication and it doesn't work for me because my metabolism is too high. So throughout this whole process, I was in pain. Mm-hmm. So the pain was very, very, very hard for me. But like I tell anybody, if I can make it through this, you can make it through anything. Because doing this without pain medication, and any one of you've had breast cancer, any type of surgery, had children or whatever, what type of pain you're under, especially when your chest is cut open, you got 182 sutures and nothing works. Yeah. It can be, but like I said, I don't regret it. I didn't mind it. I would do it again. And so after that, I waited another year or so, because at the time I was like 34, 35. And I was telling my doctor, I was like, I want to at least try to have children. Yeah. And so she's like, Ruby, I'm gonna give you 2 years. You better marry somebody quick. So I didn't marry anybody. So she was like, your time is up. And so I went back to my oncologist, and I can say I had a robotic total hysterectomy. The surgery lasted 45 minutes. The doctor that I had was just wonderful. He does them all the time. Yeah. I woke up, had 3 little tiny scars, never had to take a Tylenol pain medication, never. So I was back in work literally in 7 days.
That's fantastic.
Yeah. So that part of it was a cakewalk.
That part was much easier for you. Thank goodness.
Much easier. And then in the middle of that process, my gallbladder went out. So I was in the middle of all.
Oh my word.
So I was like, and my doctor was like,
yeah, exactly.
Only the major organs.
I love it.
So, but other than that, I mean, I don't regret any of it. It was all wonderful, but because I went through a wonderful process. Yeah. I had wonderful doctors, wonderful counselors and things like that. And I tell people in Birmingham, it's the same exact way. you know, they can say anything negative about Memphis or Birmingham they want to say, but they're the best two cities in the world to get sick in because they have some of the best doctors in the world that really have taken care of, you know, taking care of their patients and things like that. So I can't, and I still follow up with my plastic surgeon now, you know, because like you said, it's still things you have to go through time after time. This is wrong, that is wrong. We got to fix this and fix that. So it's not like a one and done at all. You know, my flap went out on one side. I had to go in and get pigskin done. They had to sew it to my rib cage. I mean, you name it, we've done it.
Yeah, pigskin and sewing it to your rib cage. She brought that up at lunch when I met her, and I was like,
So-
I'm going to need a minute.
Yeah. So
Yeah, I wasn't ready at lunch to talk about pigskin. I will say that.
and I was like, but you know, you sleep, you don't know. So, but no, I think all of it went wonderfully. And I tell anybody, if you have the opportunity to take advantage and to do it, because not only does it save your life, but it also preserves life for you and your family. Yeah, it does.
I did not have this. I keep throwing questions that I didn't share with you, but I do have a question hypothetically for someone like who might be moderating a panel right now, and is apprehensive about getting genetic testing because she's worried about the insurance company finding out, and then what happens to my daughters who then might one day be positive as well. And so is it possible to do it in a way to where my insurance company would not know? I mean,
Yes, there is. It's called
I'm-
self-pay.
Okay.
So we do have self-pay options for those patients who are not adequately insured, or if they do not want to file it through their insurance. But one thing I do tell patients to think about with your health insurance, they pretty much already know that you're having issues with your breast because you're going in for a mammogram.
because I have an MRI every year.
Well, no,
Yeah.
that is, the MRI.
Yeah.
Yes. Mammograms, that's something we already
Yeah.
do. But if you're going through breast prevention because adding the MRI to that due to family history, then that information has already been documented. So health insurance is different from your life insurance. Your health insurance will be protected through the GINA Act. That's GINA. So it's like a type of discriminatory act. They can't discriminate against you and say, okay, we're going to drop you from your health insurance because you tested positive. So try not to allow that to be a hindrance from having genetic testing done. But no, if you do not want to file it through your insurance, you do not have to. And you can go through what we call self-pay for the actual procedure. And you can speak with the actual counselor at that time. We can discuss financial assistance, and we will work with you in that order if you do not want to file.
Julie, it sounded like you had something you wanted to add. You said.
Same thing. Cash paying options for people that want to do genetic testing and maybe they don't meet absolute criteria because they have a small family or they have a lot of men in their family, or they even have huge families. And sometimes it's hard to interpret, actual risk for some of those things. And so sometimes people just their guts tell them, I just want to do genetic testing. It's in the news and everybody's doing it and let's do genetic testing. So there are options to do it where it's cash paying. But when you find out the results, particularly if it's something that increases your risk more, then that may lead us to do additional testing and additional things. And so eventually it will
It's going to
become
get
part
there.
of your medical record. But your health insurance is protected by the GINA law.
Okay.
The life insurance. So what we tell people sometimes if they're planning on doing genetic testing is maybe, you want to make sure that your life insurance is where you want it to be, or if you want any long-term care policies, that same law doesn't protect those things, but they can ask questions when you're applying for different policy and they're going to review your medical records and all of that. And high blood pressure or, other things, diabetes can affect your life insurance anyway. So, those are some things that you're born, that you have potential, to things that you're born with. So we just try to tell people that, we can't always keep it out of your medical record per se.
Yeah.
And your children, yes, you have to think about things with your children, but they can make their own decisions when they're at an age to make that decision as well. You're making the decision that you want to make for yourself at the time.
Okay. Do we have any questions from the audience? Oh, Janet. All right.
I don't know, Adriana, or Julie, how old or young do you recommend that
I'm going to repeat the question for people at home in case you can't hear it. How old do you recommend for children of someone who is positive to be tested for genetics and risk of cancer?
Beginning at age 18, because if they're younger than that, you really can't change their medical management guidelines. But what I do suggest is that you let their healthcare practitioner know there is a genetic mutation within the family line, or there's a family history of particular cancers. So that way, say if there's colon cancer and the youngest person in the family that has been diagnosed with colon cancer is 25 years old, well, they can't start having colonoscopies that young, going back 10 years, 15 years old, but you can let their pediatrician know there's a family history of colorectal cancer, there is Lynch syndrome, whatever may be, that's there, so that their pediatrician can keep an eye on them and talk to them about things to look for, such as blood in their stool, if their stomach is cramping, different things of that nature. But as far as to have the actual genetic testing, beginning at age 18, so that way they can start their medical management guidelines depending upon the family history and NCCN guidelines as well for testing.
Anyone else? Any other questions in the audience yet, Shanara?
I know they can drop you if they want.
Right.
So the question, I'm going to repeat it. The question is, are you obligated to report to as you apply for life insurance, any kind of genetic testing or that sort of thing?
For life insurance, if they contact you and request that information, is completely different than you volunteering to say, hey, by the way, I have genetic testing. The same as Julie was saying, you wouldn't call them and say, hey, by the way, I now have high blood pressure. Do you want to add this to my medical record, even though I have my life insurance? So think about genetic testing and cancer as, the same within that. Does that make sense? Okay. Yeah. So
And I can say, because I've changed my life insurance and increased it over the years, especially after my parents passed away. And no, dear, you don't tell them. If they find it out, you let them find it out on your own. No.
If they ask, you have to tell, but you don't have to volunteer that information.
And it's not on the paperwork.
Yep.
Luckily, we don't have anyone in insurance here who's cringing right now. I might see an expression in the back of somebody who's like, any questions? Do we have questions, Elena, online?
Tamika Brown has her hand raised online.
Okay. Can I? She's unmuted. Okay.
Oh, I'm unmuted. Good morning,
Yep.
everybody. Hi.
Hi, Tamika.
Hi, good morning. This is a great conversation. So thank you for having it. I knew nothing about genetic testing until I found out I had breast cancer. So it's great that these ladies are saying they had it in their history. So I'm the first person in my family to have breast cancer. After the genetic testing, we found out it was on my dad's side, way up the chain. So I'm triple negative BRCA1. So that was scary. However, the good news is I was thrilled to get a letter saying my daughter could get her mammogram starting at 25. My son can get tested. So I just wanted to say it's great that some of you guys know your history. Unfortunately, I had no evidence of it, so I didn't know. But I'm glad I found it. I was stage 2. Because of the BRCA1, I've had multiple surgeries to decrease my cancers coming back, because the BRCA1, then you're more susceptible to colon cancer, pancreatic cancer. I thought it was bad just having breast cancer, but no, there's other things with the BRCA, which is scary. So I just wanted to say thank you for having this conversation. Number 2, when I got my testing, there was 2 options for a panel. I want to say there was like a 9 panel and like a 23 or 18 and 23. And the genetic counselor asked which one did I have? And I said, well, why wouldn't I do all of them? Is there a reason that some people only do the smaller genetic testing rather than doing
The full panel. Yeah.
Yes, full panel. I'm sorry, I don't know exactly what it's called. It was a few years ago, so I apologize.
Yeah.
how I advise our patients are how much information do you want to know? So do you only want to focus on the cancers that are specific to the cancers we know in your family? Or like you said, you don't know a lot of information about your family. So sometimes people feel like, well, if I'm going to do genetic testing, I want as much information as I can. And the cost is the same, whether you look at 2 genes or 83 genes, and the panels continue to improve. And so we often retest people later on. So if, you had testing 15 years ago, we might have only looked at BRCA 1 or 2, but now we can do more genes and include things like PALB2 that if she had had testing 15 years ago, we wouldn't have known about. So you can always update genetic testing because we are learning about new genes, and it's just how much information that you want to know. So you can add as much or as little as you want to know. Sometimes when you include more genes in the panel, you're more likely to get those variants of uncertain significance, would just muddy the water. We say that we're kind of innocent until proven guilty. That's how I like to explain them as well. But the more genes you include, especially the newer genes, the more likely you are to get one of those variants of uncertain significance, which may or may not increase your anxiety. So we counsel on that as well. But you can include, we try to target the genetic testing to your family history, but there are crossover genes that might include breast and pancreatic, or breast and colon, or ovarian and colon. And so we do take into account family history, but some families don't talk about family history, and that's okay. And so that's where consumer-based testing has come in, which makes me a little nervous, but as far as counseling, but there are ways to do genetic testing. It's gotten a whole lot easier and a lot more affordable than it was a few years ago.
Great. And I have one more follow-up, because when you just said that about pancreatic cancer. So now I'm going to have a colonoscopy soon.
Okay.
And the doctor said, we could do pancreatic testing, but since you have no history of pancreatic cancer, we're not going to do that. And I was like, well, why can't you just test it? I mean, if I'm going to be there. And he was like, well, a lot of times insurance doesn't cover it. So, I mean, I know insurance is insurance, but wouldn't it be safer to say, well, just get these out, and if you don't have it, you don't have it, versus not getting tested and then finding out your colon clear, but your pancreas isn't because you didn't get tested until 3 years later.
Yeah. Pancreatic cancer is a tough one to screen for. There are some cancers that we don't have really good screening for. Colon is one that is great. You can do those colonoscopies, get those polyps out, and you can prevent colon cancer by doing those. Pancreatic cancer, even if we find things, there's still screening is pretty new recommendation for that. And even when we find things, what do you do with it when you find it is still kind of what our issue is. And so you do have to have a reason to get insurance to cover screening, and the screening that we have for certain types of cancers isn't great. So we like to have a good reason to do something, because then if we find something, then you need to be able to act on it. So just listen to your body. If you have symptoms, make sure that you are communicating those to your physicians so that they can screen you more closely.
You want to answer? Yeah.
Just to kind of piggyback on something, I know she said that her insurance wouldn't cover the pancreatic screenings. Talk to your physician also maybe about writing an appeal to your insurance company, because you do have the genetic mutation that puts you at a higher risk for pancreatic cancers, and just to pull every little toothpick that you can to see if you can get insurance to cover that, because of that high risk mutation that you do have for pancreatic cancer, which is a rare cancer within itself, to show you want to be proactive. And that is something that maybe you can speak with your physician about, to possibly write an appeal for you.
Okay.
Screening would be different for looking for colon cancer versus pancreatic cancer. So while you're asleep, I could understand where you would want to do both tests at the same time.
Yeah.
And your insurance, there are national guidelines that recommend screening for certain types of cancer if you have family history or if you have other influencing factors. So yes, talk to your physician and make sure that they're aware of all the information.
Beth, I saw your hand. You have a question?
Yeah, I think that I had genetic testing after my breast cancer had metastasized. I think that was the time. And my motive, we knew I already had cancer. My motive was that I had a childbearing age daughter who was considering getting pregnant. It didn't come back positive. She was relieved. But I now wonder, that data that's sitting there somewhere, does it have a role in like my life now? I don't. Is there anything ongoing that can be known from?
It would be, yeah, that's what it would be helpful for somebody to review your genetic test results, whether it be a genetic counselor or your oncologist or whomever, because, you might need updated genetic testing, and negative results don't eliminate risk. So if you had negative testing, it might not affect. So there's certain things about genetic testing that might make you more likely to get a second breast cancer or a certain type of breast cancer or colon cancer or pancreatic cancer or melanoma. And so that's how genetic testing kind of affect your ongoing medical care. It's not just for curiosity purposes. However, if your testing is outdated or if you had a variant of uncertain significance, even though when we give those results, we say you need to check with us or, the company every year to make sure that it's not updated.
That's actually where I was getting. Is that my responsibility as a patient, or do results live in a database somewhere that get tickled?
The testing company, that when they have variants of uncertain significance, they keep that, and then they send when there's an upgrade, and it could be 5 minutes from now, it could be 15 years from now. And when there's an upgrade on those genetic test results, they send them to your doctor, and then your doctor usually updates you. They wouldn't send them to you directly because sometimes you need counseling based on those results. But if you've changed doctors, if you've changed addresses, if you have a different phone number, you no longer have that email, sometimes it is hard to track people down or whatever to get them those results. So we do try to put some responsibility back on you to remember, hey, check with us every once in a while. But there's also a company called My Gene Council that you can upload your genetic test results in, and they give you it's called a living lab report, and they kind of keep you up to date as we learn. And they have some information within their database, but not all genetic companies will put their data into that database.
One additional thing, most patients that have they're going through breast cancer, and once they're in remission, you have your follow-up. So you come in once a year. And so when you see your oncologist or your radiation oncologist, they will also be aware that you've had the genetic testing, because that's right there in your documentation. And we have tumor boards so that we know if more genes have been added to panels. And so a lot of times your oncologist may also say to you, well, new genes have been added to the panel, so let's look at having an update test to you. So we do try to help out as well. And we also tell patients, every 5 years or so when you're coming in, it kind of will jog your memory as well when you're coming in for your follow-ups. Just say any new genes, and we know exactly what that means. That means, are there any new genes added to your panel to take? And then that way they're only testing for those new genes, not testing the genes that you've already had done, which is what Julie was speaking of as well.
May not be thinking, they're just like, woo, 20 years out from breast cancer, you're doing great. But they may not be thinking, she was 42 when she was diagnosed, maybe, or going over the family history every single time you come. And so be an advocate for yourself and just say, is there anything new testing or new things since last time I was here?
Thought I saw a hand raised online. No.
Not anymore.
Okay. No more, any questions?
Can I?
Yeah, go ahead.
I've had patients and women say to me kind of on the other end of the spectrum, I don't have family history, so I don't need to worry about it. And, give advice on what you say. Obviously, most women with breast cancer probably don't have a family history, but I didn't know if there was something else y'all say or tell folks that would encourage them to take it serious even without a family history.
Well, definitely, we check first of all to make sure that the patient meets criteria, because everyone cannot have genetic testing done. And as Julie mentioned earlier, 65% of cancers are sporadic. And then that little piece of hereditary cancers, that's 5 to 10%, very, very small. And then we have the 10 to 15% of cancers that are familial that just run in the family. So even if there is not a family history of cancer, do your self-breast exams, know your body, because even though there's no breast cancer there that has shown up, who knows if that patient may not be the first one within their family that gets breast cancer. So at that point, just definitely make sure you know that you do know your body, do your self-breast examinations. And if they're at a younger age, then that's what will jumpstart for them to have the genetic testing age 50 years old or younger.
Yeah, there are certain red flags that we look for when we're thinking about, this is a no-brainer. This person should have genetic testing. While there are red flags, we know there's some limitations to family history for sure. So,
Yeah, Anna.
So what are the options for women like in the Hispanic community that don't have insurance to cover the testing? What are the options for those women?
I'm going to repeat that question. The question from the audience is, what is the option for women who don't have insurance and want to have genetic testing?
Well, even if a patient does not have adequate insurance, if they meet criteria, then we can always discuss financial assistance plans with those patients through the genetics laboratory. So that way they can have the genetic testing done and they don't feel that, gosh, I need to have this testing done. I don't have the insurance. And it's just a very depressing feeling if it's something that you know that you need to have done. So don't let that be a deterrent to not come in. We can always discuss financial assistance, and the genetics companies, they know how important this test is. So they have almost bent over backwards in so many ways to make sure that those that do need testing can have it. So definitely, call us at Ascension St. Vincent's. We'll be glad to speak to anyone who feel that their insurance is not adequate as far as with coverage, and we'll be glad to do prior authorizations, whatever may need to be done in order to make sure that you can have the genetic testing done if you meet the criteria to have it done. Absolutely.
Patient assistance programs out there within the genetic testing companies. People that think they wouldn't qualify often are surprised that they do qualify. And, if you need genetic testing, they want you to be able to have it. And so no insurance, limited insurance, don't let that be a deterrent.
I see we have a question online. What does it say?
She can unmute.
Oh, yeah. Lynn, you want to unmute and ask?
I do. Foremost, I just want to tell Jennifer and Ruby, thank you so much for sharing your stories and being courageous to do that. I was 28 years old when I had my first lump discovered. Was terrified because a family member had breast cancer. Thank God it was benign. And I would just want to give a shout out to Julie. I'm one of your patients. And 3 years ago, I had another scare. Was being monitored every 6 months. And again, thank God what they thought was not cancer, but I am just grateful and have so much peace that I'm part of a program that you all have at UAB that does get monitored regularly. I think I'm at 22% risk now because 5 different cancers have been in my family. But I'm just so grateful for you all even doing this panel and want to encourage others who may be leery of it to have that assurance and be connected to people in the community and the medical field who are watching out for you to be ahead of the game if it does come back negative. I just want to encourage you to do that because I have that support and know that it's there. God forbid I do come back with another negative test and get a cancer diagnosis. So thank God. I've been through the scare twice, and that's scary enough before I even told you have cancer. So anybody who may be on the line there questioning it, I encourage you to go get that testing and just know what's there ready for you.
That's great. Thank you, Lynn. Any more questions? Anything that we haven't covered that y'all want to make sure we do? I guess, Julie, we're going to be adding that to my next appointment for a discussion because I think I've been convinced here today. Put that in my record. We want to thank all of you for being here today. This was a great opportunity. We're so grateful for this panel. We have 2 more Candid, it's harder to say than you think, Candid Cancer conversations coming up. Next Friday is sex and body image after a cancer diagnosis and treatment. And then the one at the end of the month is end of life and palliative care decisions. So really hard topics, we know that, but sometimes, as we were saying earlier, knowledge is power. And so we want to give you an opportunity to have a safe place to talk about hard subjects, regardless of the cancer that you may be dealing with or affected by. And please know that if you have received a breast cancer diagnosis, Forge is here to help you in any way that we can. Our goal is to solve any obstacle that stands in the way of you leading a long, quality life. So give us a call and let us know if we can help you. Thanks, everybody. Appreciate it.